Hello, everyone, and welcome to RevMD Sex Bites Podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Farideh Golembiewski, nurse practitioner here at RevitalyzeMD. And we've got a good podcast today. We're going to talk about the PShot, one of our favorite procedures we do in office for our men.
Yes. So if you're looking for stronger erections, better performance, better orgasms, decreased in premature ejaculation, like this is one of the services you can do. And we've done other podcasts that have included the PShot in it because we've done some podcasts that have talked about comprehensive services for men and sexual wellness.
So if you're curious at all about what some of the other services we provide here, check out our other podcasts and hear all about Gainswave and hormones and the other treatments we have.
So this one, the PShot, is otherwise known as the Priapus shot. And so again, Priapus is like a Greek god. And so you can always
get that.
God of
fertility.
Yeah, god of fertility. So that's what this is based on. That's what the name comes from. But a lot of people think it comes from PRP because that's what we're using during that shot. So PRP is platelet-rich plasma. If you haven't heard of that, we are going to use your blood to repair tissue and regenerate. And so we draw your blood, spin it down, get the platelets. The platelet concentrate that we get then has a lot of growth factors in, and we re-inject into tissue to get regeneration of blood vessels and nerves, and therefore better blood flow, better erections, and better sensitivity and orgasms and all the things.
Mm-hmm. So some questions we get very often about the PShot is it actually one shot? Does it hurt? How long does it last?
Mm-hmm.
And are there any negative side effects?
Yeah.
So we'll just kind of hit some of those.
Yeah. Those are
topics.
Very common questions. So what was the first one again?
How many?
So
the
how many?
PShot is actually more than one shot.
Yes.
It's multiple injections.
Yeah. And so every man, I think, is nervous about getting a shot in the penis, and that's understandable because it seems like it would be painful, but it is not. So we do some topical numbing, and then we end up doing a penile block or numbing the penis, so you don't feel a thing during the procedure.
Yep.
But then after that, we are doing multiple shots during the PShot, and this is a pretty standard. It's not a pretty standard. It is a standard procedure if you're trained in one of the PShot providers. So this is a provider network that the providers pay to be a part of, to learn training, to learn how to do it the proper way, to use the right kits so that you get the right results. So
it is more than one shot, guys, but you are numb. We do a penile block, as Dr. Durst said, so you're not going to feel anything. It's actually very comfortable. Most of the time while I'm doing that injection, I'm just talking with the guys, talking about whatever.
Yeah.
They don't even realize. I tell most guys, just don't look.
Yes.
And they don't even know that I'm injecting when I'm injecting. So it is a very easy procedure.
Yes. We use the best kits. We have the best technique because, again, we're trained as a PShot provider. We actually train other offices to do our sexual wellness procedures such as O-shot, PShot, Gainswave, all of that. So basically, you're numb. And again, I think the first time you're going to be nervous no matter what until it's over. That's common. But at the end, you'll be like, that's it.
No big deal.
Yeah, that was
I always ask guys on a scale of 0 to 10. 0 being no pain, 10 being the worst pain, where we're at. They usually say a 0.
Yeah.
Maybe a 1. But for the most part, they're like, yeah, didn't feel anything.
And so when we're doing our sexual wellness consults, we're actually doing some scoring for patients. So we'll do what's called a shim score, which is an international erectile function scoring. And so it ranges in between 5 and 25. So 5 being you have no function and we have a lot of improvement to make. And that could be because you're older when you seek treatment, or maybe you've had some penile surgery, prostate surgery, something like that. Or 25, so 5 to 25 meaning you have no dysfunction. You just want better erections and performance, which there's nothing wrong with that either.
Looking to improve.
Yes. When they talk about size too, that is one of the other questions. And since we're talking about no dysfunction in a score of 25, if we were doing that objective score, to just say that sometimes men will do it because they will Google or they've talked to buddies that have had it, and basically it'll say something about increasing size. Again, we don't promote that because, again, that's not something that's solid and proven.
No. And some guys say they notice some change in girth, but that is not a guarantee, but it's not necessarily typical.
Yeah.
When we're injecting platelet-rich plasma, we are putting a large amount of platelet-rich plasma into the penis. So you may see something temporarily, but usually that is not something that is sustainable.
And I really think that if you're not rock hard with erections, if you do suddenly get an improvement in erection, so you're going to get an improvement in size.
Absolutely.
So I kind of think that's where that comes from. But there are a lot of young guys with no dysfunction.
Oh, there's recordings. Have you seen that?
No.
So my husband pulled it up. So there are websites where guys will go in and they'll do like pre and post measurements, and they are convinced that it changes girth.
Yes.
But there is nothing that shows that. But I think what Dr. Durst said is that if we're improving blood flow, so we're getting stronger, harder erections, you're going to have a change in length and girth because you have all that great blood flow in.
Yes. And they will, like, there is a lot of stuff on the internet with patients saying that. But again, PRP is your own blood regenerating. So a lot of times we haven't seen a large amount of studies. There's actually a large amount of studies on PRP, but not something that looks at size. So you're not going to find a huge randomized controlled double-blinded study looking at size.
Nothing solid.
No. And so,
some guys recording size.
That's about it though. But so anyhow, so I think that like, again, you actually maintained right there.
I did really well. You did not.
I know. And then after the fact, like every once in a while, there'll be a term that applies to, the procedures we're talking about. And, you can't help but, just kind of giggle at each other, right? Because again, if we're saying it in a patient's room, they kind of look at us the same way. So this is a daily conversation between patients and ourselves. So it just kind of naturally spills over into a podcast. But so it just shows you that we're very comfortable talking about these procedures, talking about erection changes, and so are patients. And again, there's not a lot of places to go to talk about that. Your family doesn't want to talk about it. Your brothers, your dad.
You're probably not telling your friends, hey guys, I'm having some erection problems. Yeah. And that's okay. Yeah. You need to find an office that is open, that does these procedures, that does these treatments, that you trust, and you can have these conversations in an open environment. Yeah. We joke around with our patients just like we joke around with each other in these podcasts. It is very easy in the office because these are conversations we have every day. These are treatments we're doing every day. So it's nothing new to us.
And they can
just
actually
another Monday.
And they can be very uncomfortable conversations, but once they get here and they start having them, it's very comfortable. So again, if you think about PRP, there's lots of studies on PRP. And so we do a lot of PRP procedures. Sexual wellness just happens to be one of them. O-shots, P-shots, and P-shots are for men. So like we talked about, we're using your own blood, getting blood, spinning it down, getting the platelets. Platelets have growth factors. Yeah. And then we're re-injecting them into the penis for improvement in blood vessel health, blood flow, collagen and elastin, so that your erections stay in the smooth muscle.
Absolutely.
And fibrous lining, and then also nerves and sensitivity and better orgasms. So you get improvement in a lot of different things.
So we're talking about regenerative medicine. So we're not sticking a Band-Aid on something like a little blue pill does. Yes. We're actually making functional change. That is the goal of treatment, is to improve overall blood flow so that we're not relying on medication if possible, or not relying on an injectable like Trimix.
Yes.
So we're trying to do one better. So what's interesting, and there was a study, I believe it was in Europe.
Yeah. Well, there was a couple. So like the
one with the point change.
Are you talking about the Journal of Sexual Medicine, that one?
No, the one where guys on their shim scoring had a 5-point improvement.
So there was a big one in the Journal of Sexual Medicine that came out. That was 2021. But after that was the 2022 one.
That's it.
And that one was in France in a urology journal. Yeah. And that's a 5-point improvement. It called it a moderate improvement.
Absolutely. So when you're thinking about a scale from 5 to 25, if you're at a 15 and you go to a 5, you're not using.
You go by 5 and you're at 20, and now you're 5 off. Yeah.
Now, and we do another 6, and then you're at 25, and then we have no issues with function. So 5 points may not sound like a lot, but on the scale that we're using to figure out function, that's a huge improvement, guys.
Yeah, it's a 20% improvement.
Absolutely.
And so like, again, if that's your function, You want to see that in improvement. I would take moderate improvement. If it was like a scoring system for women we had, and you got a 20% improvement.
Absolutely.
Out of 25, you had a 5 point.
And that study was just looking at the PShot.
PShot only, yeah.
So that is not including hormones or GAINSWave treatments or anything else.
All the other comprehensive stuff that we do.
Just the PShot. 5 points.
Yeah.
That's awesome.
We always pair ours for the most part with GAINSWave unless the patient really doesn't want that or doesn't have much in the way of sexual dysfunction and basically are looking for size or better performance and have looked on the internet, found a lot of guys talking about it and come in. Otherwise, we're pairing it with GAINSWave. So you're right. That improvement is significantly better when you're doing it with GAINSWave in addition to the PShot. So
absolutely.
And if you haven't really looked at PRP a lot, I always compare it to like if you have a cut on the arm, the platelets go and stop the bleeding. Mm-hmm. And those platelets obviously have growth factors in your growing skin and arm tissue back. And so the same thing happens in any tissue. Those growth factors communicate with stem cells in the area and then are going to, improve blood vessel health, nerves, collagen, elastin. And in fact, it improves and works for Peyronie's disease too, which is a scarring and abnormal collagen formation in an area causing curvature of the penis. So great procedure for that. And we can inject it right into the scar.
Which is nice. I've had some guys with pretty severe Peyronie's and they've asked, well, will I be straight again? Well, most guys are not straight as an arrow. Most guys have some curve. So no, we're not going to be completely straight. But if we're having pain with erections, what we're seeing is with PRP, with the PShot, that pain is going away, that we're able to get an erection without pain or lessen the curve and break up that scar tissue.
Yeah. And it's painful for the partner too. So partners have discomfort with curvature. And then again, it's progressive with time, not only the curvature, but erectile dysfunction is progressive with time with Peyronie. So we can inject PRP into that. We actually will do GAINSWave over the scar tissue as well. And penile pumps help a lot with Peyronie's disease and any kind of erection changes. So if we're doing a PShot, we're basically using a penis pump to help, get erections and get blood flow in for regeneration of tissue. So we always pair it with our PShots. Yeah.
The more healthy blood flow in, the better. That's what erections are, is blood flow. So why not bring all those growth factors and all that platelet-rich plasma that we're taking from your blood, right? We're taking a concentrated amount and then injecting it in. So there's still some of that, not as concentrated in your normal blood that flows. So pump, bring that blood flow in and help that regeneration.
Yeah, harder erections, better blood flow, better sensitivity. So are we doing more than one? Again, that depends on where you are on the scale. So a 5 to 25 with the shim score. If you're lower, we're going to recommend more. If you're higher, we're going to recommend, maybe starting with one. If we basically can do more PShots and more GAINSWave until we get you where you want to go, unless if maybe you've had a prostate surgery in the past, and then we may not be able to. And then you move to a maintenance. So most guys will do a PShot at least once a year.
Yep. So that's the other question is how often do I have to repeat this?
Yeah.
And typically 1 to 2 years is what we see.
Yeah. And again, it's dependent on men. So if they see a lot of improvement, sometimes they'll continue on with GAINSWave or PShot. And again, we usually do 1, 2, or 3 PShots depending on where you're starting. We call the GAINSWave almost a 6-pack. You're doing 1, 2, or 3 6-packs so we can get you to where your end goal is, which we usually say is one step ahead of where you were. So
we're looking for progression.
So if you have, just a mild, you're noticing some nocturnal changes in erection, you're not waking up with morning erections, you aren't consistently getting an erection, to have sex, so that affects you mentally. Mm-hmm. We want you to consistently get that, not need medication. If you're on medication, get off the medication. If you're on injections, move to medications for erections.
Yep.
So progression and improvement is what we're looking for. Okay. And then we don't take people off any blood thinners. There's no medication that indicates that you can get a PShot. Anyone can get a PShot. It's your own blood repairing your tissue.
We're taking your own blood. So when I get asked a lot, what are negative side effects?
Yeah.
And when we're talking about using your own blood, we're not using a medication that's going to have a negative side effect. Mm-hmm. This is something that your body recognizes because it's yours. Mm-hmm. So negative side effects, there are none. We may have some slight bruising at the site of injection, but that's very rare. But really, that is the only thing.
Yeah, no side effects reported.
That
Lots
you
of
could
studies on
possibly
PRP
notice.
with no adverse effects from PRP.
Just potential bruising at site, but even that, like I said, is rare.
Yeah, when I think anytime we put a needle in anything, people
bruising.
will ask that about Botox. And I'm like, if I'm putting a needle in something, you can potentially bruise. That's always a potential. We cannot predict that, but it's very rare. I would agree. We hardly ever get it. Even if somebody's on a blood thinner or an aspirin a day, we don't take them off and we still hardly get bruising.
And even in the studies that are out there, they're not reporting any complications at all in any of the studies, which is important to note.
So basically, there's no contraindications, there's no adverse effects. It's your own blood. Again, how many you need depends on where you are on that shim score, and that, we're going to do during your initial evaluation. And there's, again, maintenance involved, and usually like a year, maybe a year to two. And we'll talk comprehensively with you about how we address sexual wellness overall. And there's some videos that do talk about our other procedures, although this one's mainly about PShot.
Yep. So we want to always fix the cause, right? So what is underlying, what is causing the dysfunction? We want to address those so that we're not regressing.
Yeah.
That as we're doing these PShots, it's lasting. You're getting better benefits, more benefits, and that we're not seeing it reoccur because we're not addressing the hypertension, the diabetes,
the metabolic syndrome,
the metabolic syndrome, the low testosterone, whatever it may be.
Yeah. And so we've done another, podcast on metabolic syndrome that just talks about all those diseases that you can get that actually increase your progression to more severe erectile dysfunction. So again, we're talking, sometimes those conversations about being overweight or not making healthy choices are hard to have with a primary. And again, they're using medications or surgeries to improve, where we're going to have tough conversations with our patients. And it needs to happen. I mean, you need to have all the information, know what kind of choices you can make, how to comprehensively address the root cause of whatever's going on and prevent disease, if possible. So.
And if you're here and you're doing these treatments, if we're doing a PShot, if we're doing Gainswave, if we're doing testosterone, whatever it may be, you're investing in yourself. So we should invest completely, right? So making those lifestyle changes, having those conversations, knowing what's causing it, what may be causing it, and then how to rectify it.
Yeah, absolutely. So we have all those conversations, again, lifestyle choices, being more active, having a healthy weight and eating healthy. And, again, there's some supplements that help with all that. There's a very comprehensive way to address all of it. And the PShot's just one of them.
Absolutely.
So this is basically a recap of the PShot. Again, your own blood to repair tissue, better blood flow, stronger erections, better sensitivity, better orgasms, decrease in premature, ejaculation. So there's lots of things that can improve with the PShot and peronees or curvature. So let us know if you've had a PShot, what your experience has been, and anything else you might want to hear about. Share with friends, subscribe, do all the things. And then again, remember, we're here to revitalize your look, your health, and your sex life.
Thank you.